Oftentimes, I overlook the progress that has been made throughout the entirety of the semester because I'm looking on it as at a day-by-day basis and not from a place of where I started. Where was I at a year ago? Where was I at 2 months ago? And just to have that view, the growth is absolutely insane. There are key concepts and key features of being a PTA in language that I have never even heard of before. If you were to say words like paraffin, diathermy, dexamethasone to me, I would assume that you would have made those words up. But now not only do I understand what those things are, but I understand when it is indicative to use those things, why a patient would benefit from those things, and also the parameters for those machines. Things like setting up an ultrasound machine, traction. I know those parameters, but that's one of the things that I'm most thankful for, just with the hands-on lab experience. If we didn't have that hands-on experience, yes, I could memorize the parameters and all the numbers and the reasons why, but if I don't know how to use the machine, I'm not going to be able to apply what I do know and what I have memorized and what I have understood. Before this semester, I have always known that things like ice and heat were good following an injury, but I never understood why, or why you would use one over the other, what the appropriate timing was, all the things. But one of the common injuries that I've experienced myself or that I have seen just with other people is an ankle sprain following an injury, stepping off a curb wrong, whatever it may be, the ankle swells up like crazy. And this is debilitating. It limits their range of motion, which is going to affect the way that they walk and the way that they sleep, and this is going to then lead to compensation too. And they're starting to use muscles incorrectly. Their posture just gets bad, all because their ankle swelled and they don't have that proper full range of motion. And this can lead into also affecting their normal function and normal activities that they'd like to participate in if they don't have that range of motion because the swelling is too bad. So knowing that early on in an injury, applying ice to reduce that swelling, reduce the inflammation, and also movement of the ankle can help reduce that swelling so then they can get back to their sport, they can get back to walking normally, sleeping without pain. Doing all these things without pain and compensation is huge for the patient. One of the biggest safety considerations that we have learned during this semester is the use of modalities with women who are pregnant. This is so clinically important, especially when applying it over the low back, the abdomen, or even the pelvis, because things like ultrasound and diathermy can actually alter and affect the growing fetus, and that is not something that is good. We do not want that. Or other things like E-stem or TENS, even traction, that can facilitate the contractions and induce labor. And I am not certified, not yet at least, to deliver a premature baby in the clinic. Before I wanted to be a PTA, I spent a lot of time as a patient in physical therapy. And one of the things that I was most appreciative of was just the education that the PTs or PTAs would give to me. So when I was outside the clinic doing the home exercise program on my own, working towards gaining back strength, range of motion, all the things, I understood why it was important to do the things outside the clinic, why it was important to do the things inside the clinic, because of that education aspect that they gave to me. And I think too, like, that kind of flipped the switch in my brain of being intrigued by this, of why I may want to pursue that, because it wasn't just do this because I said so, it's do this, this is why we do this, this is what's going to help you. And that alone gave me enough motivation and just hope that I was seeing progress, that I was progressing towards my goal to get back to whatever I was lacking in. And that's one of the things that I will find important to share with my patients, especially with treating them in just a couple months, is just the education behind why we do those things. It alone is just going to be that encouragement and motivation for them to do the things outside of the clinic. And this goes hand in hand with just the concepts and skills that I think is most impactful for the patient. If I do not understand the why behind these certain modalities or exercises that we're doing, if I don't understand why I'm doing those things, I cannot be confident that it is going to help the patient. And if I'm not confident in what we're doing, the patient's not going to be either. But if I understand why, and I can share that with the patient too, patient education, and I'm confident in my abilities, and then that from that place of confidence, it can overflow to the patient, and that can give the patient enough faith to continue to keep going. And just being that reassurance that they have come such a long way, I think that that is just going to be half the battle, is the patient encouragement and motivation. With that being said, earlier on in the semester, I feel like I put a lot of pressure on myself to kind of know and understand and figure out the best and most appropriate exercise to give to the patient so I can best help them. But I've learned that there are actually a lot of right answers, and it's less about flexing my knowledge of what's the best, what do I know the most, and more of what are the patient's goals, and what do they want to achieve, and what do they need to achieve those functional goals. What do they need to be able to do in order to get them to that point that they want to be at? So just reinstating that with my role as a PTA, the goal is to love the patient so then I can help them get back to what they are missing. And it can be something as simple as your patient comes into the clinic that day and they may be presenting some more frustration or discouragement, and they have kind of a limp. So you ask them and you figure out what's going on, and they just note that they've been struggling with some increased swelling in their ankles after working prolonged shifts the past week. And as a clinician, we are there to help the patient. And obviously we have to act within the plan of care and the goals for the patient. But if we don't listen and understand the patient, where they're coming from, if we just see them as a paper, as another patient that we just need to check off the list so we can get to the next one, that they're just a time slot in our chart, then we're not really helping them. We're not doing them any favors. So I think that's what I look forward to most, is just hearing out the patient and being able to treat them and help them with whatever issues that they are struggling with that day, and just being present in the moment for the patient. So obviously with that patient, I have learned now that just educating them on the use of compression stockings can go such a long way, and then also elevating the feet after a long day at work. That can help reduce that pain and swelling and inflammation that they're experiencing from that. But I'm really just looking forward to helping the patients the same way that therapy has helped me recover from injuries and prevent injuries. So I just can't wait to show that same love and support that I was shown.